I am Dr. G. I am very excited today. I have a guest that it was she has an incredible platform, an incredible background. If you've been on Insta, I'm pretty sure you've seen her. She's always out there. I don't want to say disrupting could be a bad word, but I'm a disruptor. I look at her as a disruptor, but questioning what we should be doing in this profession and what people are actually putting out there. I'd like to welcome Dr. Sylvan Hammond, the honest vet. How are you?
I'm doing great. Thank you so much for the warm introduction. I'm excited to be here.
Yeah. Well, you're in Charleston right now. I'm pretty sure the weather's pretty humid. I'm an East Coaster, so I know what you're going through right now. Um, and I want to get a little bit into your background first because I think that's going to kind
Sure.
of set the stage, and then we can go from there. And also to all the live watchers, if you have any questions, please let us know. We have someone watching the chat room, so if you have any questions you wanna or any statements, I mean, obviously, what we're going to be trying to do today is we're going to try to start a crucial conversation. We're going to break down why veterinarians are graduating vet school with fear. And I don't want to mean fear like you're like fight or flight. We're talking fear like you don't believe in yourself and you don't think you're going to be capable of doing something. And that is something that is a very hot topic. I think Dr. Hammond, you got some feet. You pushed a few buttons, if I'm not mistaken, about a week ago on Instagram, didn't you?
That's what I do. It's
Well, that's
any engagement is good engagement, as some would say. So
yeah. I
yeah.
mean, and that's the problem. The problem is like I look at this profession and I look at what people are doing and saying on socials or on even where social posts. And then you look at what people are truly trying to do about it, and there is this disconnect. Veterinary medicine, I believe, is very scared of change, and that's where the fear is, in my opinion, is just change. And I think a crucial conversation is to be had on why basic procedures, well, what you and I would look at as basic, are now being referred for the gold standard. And there's nothing wrong with the gold standard, as you said.
No.
As you said, there was nothing wrong with the gold standard, but is the gold standard affordable?
Yeah. And accessible, right? I mean, not every person lives in a town or a city where there are specialty clinics. And asking people to drive 3 to 4 hours to have their chicken seen, or maybe it's their old yeller, right, their old dog, the backyard dog who needs some surgery. That's a big ask for a lot of people. Unfortunately, you're asking them to take a day off of work. You're assuming that they can get the pet 3 or 4 hours wherever they're needing to go. They might then have to stay overnight. They mightn't be able to come back. Maybe these people have families, can't just up and go. What if you've got young kids? So it's not always an option for multiple reasons. And while I love that we have that option, we have to acknowledge that it's not practical in all situations.
Yeah, you just had the light bulb go off in my head. I think an article needs to be written for veterinary intelligence on what the new definition is of gold standard compared to 20 years ago. Because you bring up a very good point, because the cost of care at some of these referral practices are through the roof. And then you
Yeah.
also add in they got to miss a day of work if they have to drive, they have to stay in a
Mm-hmm.
hotel overnight, they have family.
Mm-hmm.
I mean, yeah, in Southern California, we are blessed. We are blessed with amazing referral centers, but the cost of care
Yeah.
is a huge pullback. How many referral centers do you have in Charleston right now?
We've got two in like within kind of Charleston, and then one that's a little north but drivable, like 30 minutes. So we have three, like a little triangle, and they're all fantastic. We also like have a veg that recently opened up, which is really nice. We have like a really good, capable emergency clinic. But with those places comes those high price tags, and I wouldn't be able to afford some of the quotes that I see for care. My German Shepherd, um, rest in peace, Hugo. He was the greatest dog in the world, and had a splenic tumor. And it was one of those things. I diagnosed him on vibes. I had my first son was about 7 months old. And I walked downstairs with my cup of coffee and I took one look at my dog and I was like, okay, it's happening. Like, it is happening. He was 12 and a half. And I just knew. I just looked at him. Something wasn't right. I went and checked his gums. They were still pink. Put my hand on his heart to feel that heart beating. I thought, okay, we got to get you to the clinic right away. Drove in, showed up at work, got him on the x-ray table, took that x-ray, like burst into tears. I was like, oh my gosh, like, it's happening. And I have lived that scenario now. So I've been in the shoes where I'm thinking to myself, am I going to do this surgery or am I going to go to the tertiary hospital? And Hugo was my college dog. He was my soul dog. And I thought, okay, I love this dog. I'm way too emotional right now to go into surgery on my own pet. Like, I'm too overwhelmed with emotion to remain calm the way that I would want a surgeon to be. So I'm not the person I want to do surgery on my dog right now. So I called all the specialty centers. I was like, who is cutting? You know, we all know the vets in the area. And I went to the doctor that I felt the most capable with. And they quoted me $7,000. And I looked through the estimate.
With a discount?
With my veterinary discount, with my 20% or whatever it is that they give you, it was $7,000. And then I'm sitting there and I thought, okay, like, this is the dog I would do anything for. I'm going to pay it. But because I have a medical background, I'm a veterinarian, right? I went through the estimate. I'm like, I don't need another ultrasound. We know there's a big tumor in there. Get it out. Do an X-lap while you're in there. I don't care about lymph nodes or cut it out now. I don't care if he's got 3 more weeks to live. We're doing a surgery. So I was able to cut it back to like $5,500, I think, because I also picked him up the next day. I said, he doesn't need to stay 2 nights. I know what I'm doing. He's going to hate it here. And he was they actually called me. They're like, come get your dog. He's a German Shepherd hospitalized. Like, you can imagine, he was not the easiest patient. He was probably having diarrhea everywhere. And anyway, so I cut that down. But I think, could I do it again? Would I do it again? How often could I do that? And then think about our technicians. I think of that all the time. These girls, most often, also sometimes guys, they're getting paid so minimally and they work tirelessly to care for animals, and then they wouldn't be able to afford to care for their own pet. And that, to me, just isn't right. Like, that's where the system, I think, needs to have confident and capable generalists who say, hey, you should go to the referral center. I went to the referral center. I think it's amazing to refer. But if you can't afford it, if it's not close enough, if you just, for whatever reason, it's your personal decision. If you can't afford it, I can try, right? Because I went to veterinary school. I know all my anatomy. I know good surgical technique. I know that you shouldn't have blood bleeding, like, you stop the bleed things, you don't contaminate the abdomen, you close the things, you fix it, like, you can do it. And I think that is kind of what you were bringing up and alluding to, that there's this confidence missing, that these students say, okay, it's refer or nothing for this foreign body surgery. But if you can spay a dog, you can do a foreign body surgery. You can do a simple I would much rather do a cystotomy, a gastrotomy, a simple enterotomy than spay a fat lab any day. Even a regular spay. I would rather do a splenectomy.
Dr. Helen, come on. Spays, they say, are routine in vet school. It's a routine spay. And my argument is you haven't done enough of them, then there's nothing routine about a spay.
There's nothing routine about a spay, because every dog is different. I did a spay on a cat 2 months ago and I was confused. I always, you have a system. We all have a system, right? When I'm doing my spay, I like to go for the right ovary first. The right is high and tight. Go get the hard one and then go get the easy one. So I'm in this cat and I usually never use a spay hook. I usually just reflect the bladder and check for my uterine horn, right? So I'm in this cat. I reflect the bladder. I'm like, where's my uterine horn? Like, where's the right? So I went in with my spay hook on the right side and still saw nothing. I was like, this is really weird. Like, this is my routine spay. This is a cat. This is like a 6-month-old cat. So you would think I'm going to be in and out of here in 15 minutes. So I'm like, So I went in with my fingers, swept around, pulled around a little bit, felt some stuff. And I'm not feeling it. That's really strange. I've done this, hundreds of times. So I went ahead and extended my incision a little bit, went down, found the left one, traced it back to the uterine body, and then pulled up. Cat did not have a right uterine horn.
I have one of those. And
Did
then you
not
got to
have a
go.
right uterine horn.
And then you had to go find that ovary though.
I
That
had to go
remnant.
find the ovary, and of course it was deformed. It was like half the size of the other one. It looked like a little bean. And here's the thing, right? That's probably a surgery that maybe a specialist should have done, right? Because I'm like, is this the ovary? I think so. It's not. It doesn't look like the adrenal gland. It's in the right spot. Like it's got to be the ovary, But it was deformed. And I used all the knowledge that I've accumulated through veterinary school and my personal experience doing the surgery to use my best clinical judgment and remove that. And then of course this cat 2 months later, she's doing great. So very confident that that was the ovary. There was also a tiny little like remnant of what should have been the uterine artery kind of tracking down that side too. So I used that as like a little reassurance that I was cutting out the correct thing that looked like an ovary. And then afterwards, when I had them both out, I cut them open, right? I cut open the regular ovary and the other ovary to compare the tissue so I would sleep better. But that's like exactly what we're saying is like no surgery is simple. Not a single one that you do is going to be simple or straightforward. And you should do these things that challenge you and change you so that you can be prepared for the ones that don't read the book or for those emergency surgeries you might have to do because you are the only choice.
And you also have to say it is absolutely normal, even if you've been practicing for over 20 years, if you do that 120-pound lab spay, you still worry that thing is going to bleed.
Oh, absolutely.
I don't care who you are. I don't care how many you've done. I don't care how many sutures, how many throws, what suture you used. You're still going to be all day. Go check the gums on that dog. Go check the gums on the dog. Go look at the conjunctiva, and you'll probably lose some sleep that night. Like, okay, is that dog at home doing okay? Or I didn't get a call from the emergency clinic. I think everything's fine. And you still call them the next morning to make sure everything is okay.
And until you hear from them that morning, the whole time you're like, I hope everything's good. I had my first surgery day after coming back from my last maternity leave. My first surgery day was a 90-pound, maybe she's 80-pound, big 5-year-old lab. And I laughed. I said, do you guys hate me or do you think that I'm that good of a surgeon? Like I'm confused because this is not very nice. But of course, and I was nervous, right? I was nervous. I thought, okay, I haven't done surgery in 5 months and this is a big dog. But, I went a little slowly and I, threw a couple extra ligatures on those big pedicles and especially where you can't even see them because there was so much fat and I'm like, well, they should be here. So I'm just going to throw some extra stuff here just in case it just went slowly. And then I kept that dog. I did her first. And then I kept her throughout the day. I checked a PCV before she went home. That's just I'm like, if the PCV is holding stable from what it was like preoperative, I think it was down like 2%. But, she had gotten fluids. She had obviously lost some blood just in the surgery itself. So I wasn't shocked by like a 2% blood loss over an 8-hour day. So I was totally okay with that. But I commented about that on social media. So talking about ruffling feathers. And I had someone say, I commented that I was nervous about the surgery and it went great. Because I also had to do a rabbit neuter that day. And as you know, like rabbits can be tricky to anesthetize safely.
Yes.
Right? They're very good at just dying, unfortunately. It's a wonderful mechanism when you're a bunny in the wild and you don't want to experience being eaten alive, but it's not great when you're a doctor or someone just trying to provide care. Yeah. And so I had a bunny, and then I think I also had like a dental that day that went great. But the bunny neuter went great, the spay went great, and I posted about the next day. I said it's so nice to have these days that go well because I was nervous about these two procedures, and I'm 8 years out of school, so wanted other people to know that it's okay to be nervous, that it's okay to maintain that kind of sense of, oh no, like what if something goes wrong, because things go wrong, but to do it anyway. Like I was nervous, I was worried, like because I felt rusty, but I did it anyway, and it went great. So that again will make me more confident and capable for future procedures. And I wrote that and someone was like, well, I don't want the doctor who's nervous ever doing surgery on my pet. And I thought, okay, well, I don't really know any veterinarians who are never, ever a little bit nervous about a surgery.
Oh my gosh. Yeah. I was about to say, you just kicked out 90% of the veterinary profession.
Yeah. Like even specialists, they know things can go wrong.
Well, I mean, my wife, she's a stud, right? Stud veterinarian, amazing veterinarian. And she still freaks out with skin bleeders. Like When she goes in for
Yeah,
her spay, she's there cauterizing the skin bleeders before she even
they're
gets in
so
there. And
annoying.
I'm like, honey, just get in there, just go. But that's
Yeah.
the trick to a very strong marriage. If you're both veterinarians, is do not work at the same clinics
Yeah.
because because the days that we would have to work together, the staff would bring in the popcorn and just be like, okay, here we go. Because she takes path A, I take path B, but we both get to the same places. Um,
Yeah.
but but that's why we call it practice. There's no real right way to do anything. And I
Yeah.
think you bring up a very important point, which is like you got to celebrate the good days.
Yeah.
And we don't do
Absolutely.
that. And that's I don't know if that's a human trait, veterinary trait, both. But we never celebrate the good days. We only and then we all we do is sit and ruminate and think about and worry about the bad. And
Yeah.
that's another problem. And again, I don't know where that's coming from either. So we'll dive into that fun stuff.
Yeah.
Because so let's go into a little bit of your history. Like you
Oh
grew up
yeah.
on a you grew up on a cattle ranch, correct? And your mom's a
Yeah.
veterinarian.
Yeah.
Your
Yeah.
mom's a
So
vet.
where am I? Who am I? I grew up in southern Arizona, Tucson, Arizona. Well, actually, about an hour southeast of Tucson, in a tiny little town called Benson, Arizona, that had about 2 stoplights my whole life until we got a Walmart when I was in high school, and we got our 3rd stoplight. So that was a big
That,
day for the town of Benson.
that was
And
a
my
Did you
family,
have a parade? With the
we
Walmart?
didn't for that, surprisingly. There's a lot of parades in a small town, I'll tell you that, but we did not have one but it was a big deal. Like I was in high school and everyone went. Like after high school, we all went to Walmart. Like like that's how small this town I grew up in. And we had a working cattle ranch, my family, and we owned and operated it. My mom was a veterinarian. She was actually an equine reproductive specialist. And then my father was a rancher and a cowboy. And then, I have brothers. And so we all did all the farm and ranch work. As a family, we had registered quarter horses. And then we also had certified Angus beef. And then, of course, it's a ranch, right? So we had the chickens, we had some turkeys. My brothers and I did 4-H pigs. We had a goat. I don't know why we had a goat, but of course, you had to have a goat, right? Like you can't not have a goat. Sheep don't do well in Arizona. It's too hot for them. So no sheep. But yeah, I grew up. That was the life. I loved my childhood. I mean, I feel like I got to do and see and experience things that are becoming more and more uncommon, just in terms of childhood experiences. Like my brothers and I would take our horses and we would just go right off into the mountains, be home by sunset. We got lost a couple of times, like we know, but we'd pop up in the neighbors, like we'd go through the river, pop up on the other side of the mountain, and they'd be like, "Okay, do you want to get in the trailer and I'll drive you guys all home?" We'd be like, "Yes, please." Like, it was just a different life. It was great, and I saw my mom, she a specialist, right? Equine reproduction, because Scottsdale is like the Arabian horse capital of the world. It's sunny in Arizona, 365. It's perfect place to be if you love riding because it's not rainy, it's not muddy. It's easy to keep horses healthy if you can keep them cool. And she would go around to different farms and ranches to help people breed their horses. And she made really good money. She basically was IVF for horses, was her specialty. But that being said, a lot of these people she would go to, they'd say, "Oh, I've got all these barn cats that won't stop having babies. So while you're here, can you just spay and neuter all of them?" And she'd say, "Sure, yeah, I'll just charge, I'll add it to your invoice or whatever." And we'd DKT all these cats and prop them up between boots on the bed of the truck and like spay and neuter them. And she'd tell me, like, if anybody twitches, give them a little bit more stuff. Cause she was always very conscious of whether or not they were in pain. I mean, it was very humane. She made sure everybody was good. We'd stay until all the cats were up and nobody got an e-collar. Just like before I knew, she just drove off. It's like, "Good luck with the barn cats. Like, call me if you need me." But stuff like that. She did a crypt orchid neuter for a 4-H kid that I grew up with in our kitchen sink on his hog. Of course, again, not great medicine, right? But he didn't have any money to take this pig to somebody in a specialty clinic. Like I said, we grew up in a really small town. So like I don't even know where he'd go. He would have had to driven like hours to find someone to do that. And yeah, my mom was like, "Look, I'm rusty, haven't done this in a long time, but I could probably do that for you." laceration repairs on anything, the farm dog that got kicked by the horse that morning. And I remember when I graduated veterinary school, even in veterinary school, I remember being like, well, that's not how my mom did it. Like she, they would be really, they were like, you got to gown in and sterile technique. And I was like, like, what is this sterile technique? Because of course, again, I'm not saying my mom was a bad doctor, and people will be upset to hear that. They're like, oh my gosh, I can't believe she was doing those things. But the thing is, a lot of those animals did very well. And so many people were very thankful that my mom tried. I remember there was a woman who lived up the street who would literally pay my mom in goat cheese for helping her goats. If they were sick, if they needed something, my mom would show up, she would do what she could, and the woman would give her goat cheese because my mom cared about the animals, and she would tell them. And she never got a board complaint, and she never got, of course, I'm sure there were some that didn't do great, right? But it was her or nothing. And so I kind of take that into my practice. Obviously, it's different today. There are some lines I won't cross. I won't be doing cryptorchid neuters in my kitchen sink.
Yeah.
Okay. But I don't live in a tiny community like that anymore.
Yeah. So, I mean, obviously what your mom did really did shape the way you are, the way you practice, and the way your mindset is.
Yeah. I mean, I would think it absolutely does. So to kind of go back to my story, I ended up going to the University of Arizona. I always knew I wanted to be a veterinarian, and it's not surprising, obviously, given my background. I saw what my mom did. I was like, that looks really great. I think I'd like to do that too. And then I went to Texas A&M. And when I was in veterinary school, I loved surgery. I loved my surgery days. And we at A&M were very privileged in that we got to go to the shelter in Houston and do surgeries basically for 2 weeks. Spays and neuters. We also got to triage all the pets that came in. And that was another opportunity for me to kind of see medicine being offered where we worked with what we had, right? We saw dogs come in with big old gnarly wounds. We had to do amputations, all of these things. All of those pets probably could have gone to specialty, right? For horrible derm cases and things like that. But these are homeless, ownerless animals. So it was like, okay, you vet students, come up with a good plan to fix this dog because you're all they've got. But it was great. It taught us to be like adaptable, and again, to use what we have. And in that time, I had no concerns or worries or fears. I was loving surgery. I was jumping in. I was like, sign me up. I'll do the things. I'll cut the things. I'll fix the things. And I was shocked. My very first day ever doing surgery as a new grad, I threw up in the morning. I was so nervous. And I didn't know where that came from because I had never experienced it before. So I went to work for private practice, or not private, general practice, small animal general practice in Austin, Texas. And I was confused by that feeling. I thought, what? And I was just so afraid to mess up because I was afraid, okay, I'm doing this routine spay. The owners expect it to go perfectly. What if I mess something up? Now I have these owners who are like going to come after me, and I'm going to lose this license that I worked so hard for. I had that fear. And I had it again the next week for my next surgery week. And I had it again my next week, but I kept telling myself, okay, if I just keep showing up, it will get better. And it did. It took 3 years of consistently showing up for myself and doing these surgeries to get better. But what helped was that I was working general practice in Austin, Texas, and I quickly realized that owners didn't necessarily know the difference between what was an emergency and what should come to general practice, right? I didn't want to do emergency medicine, but I ended up doing emergency medicine as a general practitioner pretty often, right? We get the dog that came in that would be retching for 3 days. I do an x-ray. I'm like, that's a GDV. Great. We get the cat that came in, it's been throwing up. Okay, oh, it's blocked, right? And then I'm sitting there with these animals and I'm like, okay, you should go to the referral center now. It's probably going to be like $3,000. Maybe. This is, almost 10 years ago now. So it was a bit cheaper. And they're like, yeah, I don't have any money. Right. So I'm like looking at this pet, and someone on my social media post said, this is like emotional blackmail, which I thought, okay, a little bit, maybe I was being emotionally blackmailed by these situations, not necessarily these pet parents, right? They're being honest with me. They're saying, I don't have money, right? I'm looking at this animal and I'm like, okay, well, I'm a new grad. I graduated, 3 months ago. I've never done this before, but I will do it for you, and I'll only charge you cost so that I can try and I can learn and practice if you're willing to like meet me there and do it, understanding that our risks of complications are probably going to be higher because I'm inexperienced and I don't have the staff and I don't have the special equipment. And your dog's also going to go home with you at 6 p.m. So like you're going to have to like be involved. And people would say, please try. Please try. I'm willing to spend, $500, $1,000, whatever for you to try. And I understand that maybe we'll euthanize on the table. Maybe my dog will die tomorrow, but I'm willing to spend that for a chance. And I did that a lot actually at my general practice in Austin. And I got to do the cystotomies. And eventually, as I kept doing these procedures, I became more capable with them to where I was actually charging like for my time to do them as well, instead of just materials, but still charging significantly less than the referral centers. And I have had one negative outcome in all of those. I did have one enterotomy that dehisced, but that dog was very sick when she came in to see me. She'd had a corn cob stuck for 7 days. So I'll never know if it was me or if it was the dog. The specific set of circumstances is unique for each case. So, but I
7
tried.
days with a corn cob, chances are that dog was already toxic.
She had evidence of toxic change in her lab work. Absolutely. So, but I tried, and you never know, because every other one that I had done went great. And there were some that I didn't expect to do well. I had a dog with a linear foreign body from his stomach. Yep. It was a rope toy. It's for context. So,
the saw technique.
Yep. So the one knot of the rope toy had anchored at the end of the stomach, right? Like couldn't pass out of the stomach. The other knot had gone perfectly past the pancreas, of course, like to the proximal jejunum. And then it had bunched up back to where those two were brought together. Okay. And I didn't know that. Obviously, I did the x-ray, saw that there was an obvious foreign body. It was a 5-year-old lab mix, and he was a repeat offender. Of course, he had this happen before. So I told the owner had gone to the referral center last time. So I'm telling him, he was like, this happened a year ago. I can't afford to do it again. I can't afford another $5,000. And I said, okay, I'll do my best. This is like a year after my first few. And I said, I don't know what I'm going to find when I get in there. We had the talk. So I opened this dog up. I went to the one in the stomach first and removed the knot, cut that little thing to let it go. And when it unraveled, I saw that about every 4 or 5 centimeters down the, duodenum and proximal jejunum, there was a little defect. What's the word I'm looking for? Like an opening, essentially, into the lumen of the small intestine. A hole. Yeah. There were 7 of them from the knot in the stomach to the end. So before I did anything, I said, let's go ahead and call the owner. I'm on speakerphone. I got my hands in this dog's abdomen, and my team is holding the phone. And I'm explaining to him that this looks worse than we expected. And he said, well, you're already in there. No, I said, do you want me to just euthanize on the table? Because this is pretty bad. And he said, you're already in there. Let's try your best. Try your best. So I said, okay. And then literally, this sounds horrible, Dr. G, this does, but I was like, this dog's going to die. I'm going to do my best, but there are 7 perforations. Right. That's the word I was looking for. Perforations from the lumen of the small intestine into this dog's abdomen. Like that's very serious. There's luminal contents, guts, juice, bacteria leaking into this dog's abdomen. So anyway, I had already done the gastrotomy. That's 1 incision. I went ahead and did the incision in the enterotomy site over the other knot. That's 2 incisions. And then I had 7 perforations along the mesenteric border that I literally just freshened the edges of and closed them up. And some of them were so big that I couldn't close them this way, or I would cause a stricture or an occlusion. Yep. So I had to close them the way that you're not supposed to. I had to do like this thing where you like bring them together this way, right? For people who don't have a medical background, it's hard to explain, but that was I would have gotten slapped on the hand. They'd be like, don't do that. That's horrible. That's not going to work. And then I put omental patches over all 9. So this dog had 9 incisions total. And he did great. He did great. I did not. I think I had to like go lie down after that. I was like, I can't do anything else today. Like somebody else is going to have to see the rest of my appointments. Because again, this is a lunchtime thing. And I couldn't believe it. And I was like, that dog's going to die. But I had no fear of this because I told the owner that this was a guarded prognosis. I was very open with him. This was all documented. So I said, if this dog doesn't make it, I have nothing to worry about. I tried my best. I told the owner the dog might not make this. He knows I'm not a surgeon. He understands how serious it was, and he just wanted me to try. And I think that's also important for my colleagues to remember here, because now I saved this dog's life. But if I hadn't, if he had died, I think I still would have been okay, because I did all the things that I was supposed to do, and I still tried my best. So he could have taken me to the board. Would it have been horrible? Would I have been very sad? 100%. But I think I still should have been safe. Maybe
As
I'm
long as you
wrong.
marked it down in the chart. Yeah, I mean, that's the
Yeah.
other thing. Just write everything down in the chart, your conversation. And nowadays it's so easy because all the
AI.
veterinarians have AI to scribe for them.
Absolutely.
Oh, that's so awesome.
Absolutely. And
Oh
then
my goodness.
those recordings are probably like in the cloud or something. Like I'm sure those
Yep.
companies can go back and pull a recording if there's a dispute, where they could hear me say, "Hey, I haven't done, you should refer." Okay, you don't want to refer? Okay, I can do it, but here are the problems with me doing it, just so you're aware. It's an informed consent. And then of course you have them sign documentation as well. And anyway, that dog did great. And I
Yeah.
practiced like that in Austin for about 3 years, and then the pandemic hit, and I had burnt myself out, to be honest. I was doing a lot of GP work in Austin, and then I was also working at my local emergency clinic one
For
night
the
a
girl
week because,
for the girl who said she didn't want to do emergency.
well, but I didn't. But Dr. G, as you, like we said, people don't know the difference sometimes between emergency, or people can't afford it. So there were times where I'd say, you should have gone to the emergency last night. They're like, I know, but it's $175 to walk in the door, where you're like 40 or whatever my exam fee was back then. And I
Yeah.
couldn't go. And I'd say, that I understand. Do
Yeah.
you want to go now? Because I still can't help you. I still have to refer you back. And they're like, no, I don't want to go there. That's why I'm here. Right. So, so I thought, okay, I want to be better at these emergencies that come in. I want to be confident and capable. And I want to make sure that I'm doing the standard of care to triage all these emergencies that would run in. You know, we'd have heat stroke run in sometimes in Austin, because they just happened to be close to us when the dog, you know, there was a trail, like a running trail pretty close. So people would be worried about their dog. They pop in. So I reached out to, it was Central Texas Specialty and Emergency Center. I think it's been a while. And I said, hey, I'm a pretty new grad. I don't have a lot of emergency experience, but I'd like to get some. And I'm willing to work for $60 an hour for emergency. Like, if, you know, that's pretty low for an emergency doctor, and rightly so. I mean, it's a wild ride to be an emergency veterinarian. It's very taxing in multiple ways, which is why I didn't want to do it. But they were like, please, you're hired. Like, when can you start? So I would work at my regular clinic from 8 to 6, and then I would do a 7 to 7, like 7 p.m. to 7 a.m. shift at the ER once a week. And I loved it. And I learned a lot. But as I said, in 3 years, I was like, and I'm really tired. I'm so tired. So I moved out to Charleston, and it was kind of COVID time still. So I decided to do relief for a little while and just kind of feel out some clinics and feel out some places. Did that for about 2 years around Charleston, and started a family. I found a clinic that I love downtown Charleston. It's called All Creatures Veterinary Clinic. And here we go again with my need to do too much, to see too much, to help too much. This clinic literally saw all creatures. It was founded by a man, Dr. Doug Berger. He's an awesome veterinarian. And when he first graduated, very much like my mom, he saw all the things, and he did all the things because he thought somebody needs to do it. Someone needs to show up for these animals. And I was working alongside him, and I'd see him see a dog and a cat, and then do a splenectomy, and then he'd go in a room with a guinea pig, and then he'd do a rabbit spay, and then he'd see like a cow with a broken leg. Like, it was incredible. And I thought, thank you for reminding me that that's really what I went to vet school to do. That's what I think I want to do. That's the kind of doctor I want to be. Not that just seeing dogs and cats is wrong. If you want to just see dogs and cats, that's great. I totally understand that, because that's what I did for a while.
Was there tracking? Was there tracking at Texas A&M, or did you just?
Yeah, so you could do large, mixed, or small.
So
I tracked mixed. Okay. Yeah, I tracked mixed, and yeah. So I saw him doing all these things, and he told me, I said, how did you learn to do all these things? He goes, the same way you did. I went to veterinary school. I have textbooks. And he said, it's 2020, text a friend, send your specialist friends some videos and they'll help you. And, it started out with him asking me, he would be off and he'd say, hey, I've got a client, a really, really good client who needs to euthanize a chicken. Her chicken's 8 years old. It's really sick. And I'll walk you through it. And I thought, okay, well, I trust myself to be able to humanely euthanize anything, right? I can end an animal's suffering. I know how to do that much. I've got a textbook. I can look it up. And, he, of course, also kind of told me what he likes to do. And it went great. And then he had a bunny with GI stasis. And he's like, hey, I'd really like for them to come in and see you because they can't go to the Birds and Exotics. We do have a specialty exotics hospital in Mount Pleasant, but it's specialty prices. And I said, okay, well, as long as you're there by phone to help me out a little bit, that'd be awesome. And I just went from there, started seeing these things. And I realized, a lot of our knowledge does translate so much. Of course, there's nuances with these species, but it goes back to the surgical approach, right? If you can do a spay, if you know how to spay a dog and you know all the principles of surgery, then if you need to do a cystotomy, you can get out your surgical textbook, your Dr. Fossum's, and you can look up how to do a cystotomy. And I'm not ashamed to admit that there's also videos on YouTube of how to do these procedures. There are step-by-step guides from Clinician's Brief with amazing photos.
Yes.
And I used to print them out and bring them with me into the surgery room just in case, but I never ended up needing them. I just was it made me feel better to know they were right there with pictures in case I got stuck or in case I got lost. But I never needed them because, again, I had all that knowledge. I just was afraid to use it. And then same kind of goes to what I do a little bit with these exotics now is I tell them, I'm like, look, I saw a baby cockatiel yesterday with a deformed leg. And I told them, I'm not an avian specialist. This is why you should go to the avian specialist. But here's what I can try to do to help you. And I also phoned some of my avian specialist friends afterwards. I said, hey, I saw this bird today. Here's a video of before. Here's a video of the hobbles I placed on him. What do you think? What should I do differently? I can always have them come back in tomorrow if I need to change it.
It's all about using your network.
Use your network, right?
Yeah.
I think about my mom back then. She didn't have a cell phone. She didn't have the internet. And she was doing all those things. And Dr. Berger, when he started out, he didn't have Vin or your friends where you could send them a video so easily of something. You can text the specialists.
They were the specialists back then. They were.
Yeah.
And the thing is, we don't have enough specialists. So I mean, veterinarians should think about becoming specialists because
yes.
People
I'm not trying to
you and I need them as much as the profession and the animals need them. It's nice to always have them in your back pocket.
Yeah. Thank you for clarifying on that. I don't want to discourage anyone from specializing. If you have a niche of veterinary medicine that you love, 100% go become the master at that so that you can help all of us who aren't the masters still provide good care in the case that these animals can't get to you, right? And then also understand, I think that's something that there's a lot of this GP versus specialist sometimes conflict where, people think, oh, well, I'm not as good as the specialist, but I'm like, well, the specialist couldn't work up a nasty MSRP ear infection and then turn around and do, a splenectomy and then turn around and treat a dog with a possible CCL tear, and then turn around and see somebody who's got no money for this puppy with parvo, right? And I'm not saying that that's wrong. They have their strengths and we have ours. And it's beautiful that we have all of that in veterinary medicine. And it's beautiful if you also want to invest in being a wellness doctor. If you want to be the vet who just does wellness care or maybe senior pets or your jam, I like that too. I love that too. We need that too. But we can't lose the bulk of veterinarians who are willing to do as much as they can within their means. Does that make sense? I hope I'm coming across without stepping on any toes.
It makes complete sense. And also, if you just want to be that general practitioner, but you also want to specialize, there's ABVP.
Yeah.
I mean, you can be a general practitioner, but be a specialist when it comes to general practice. And then you can also specialize within that. There was right down the street, there was an ABVP veterinarian who did neurology. And guess what? He was a neurologist until the board certified neurologist came into town. And there's nothing wrong with that. I'm going to admit, I read both volumes of Ettinger. I read the infectious diseases. I was ready to take that test, and then they lost me when they said you got to get recertified. I think it was every 5 years. Now it's every 10 years. And you also have to write
Hmm.
2 publishable papers. And I'm like, I own a practice. I have 3 young daughters at home. My wife works full time. I don't have
Yeah.
time to write a paper. So,
Yeah. That's a
you know,
big block for a lot of us.
yeah, but I guess if it was easy, everyone would do it, right?
Exactly. And Dr. G, you led me to a great point. And that was one thing I felt people missed on my previous post. So I'm not saying that every veterinarian has to do everything. I'm not saying you have to do all of the surgeries and see all of the species, but I'm saying maybe like within dogs and cats, consider doing a little bit more, or or getting comfortable with doing a little bit more, or remembering to occasionally step outside your comfort zone if referral's not an option. Or if you don't love surgery, consider maybe doing more internal medicine stuff. Get really good at ultrasound, or get really, really good at dental if you like dental. And then you mentioned this to me before. You said a lot of veterinarians don't work together within their community. And I completely agree with that. Because if there's a lot of veterinarians practicing this way, right? Like a general practitioner who does a lot of dogs and cat stuff, but also really likes birds or chickens, right? Or I have a friend like that. She does dogs and cats. She's a dog and cat, but she also sees chickens just randomly. She loves chickens. She had backyard chickens growing up. She's got backyard chickens now. She loves chicken. She's my chicken go-to. You just got to network. You got to find people. And so that's a rant. But like, let's say she and I worked in the same town, or maybe even like an hour away. I could say, hey, I don't see chickens, but I know someone who does, who's a general practitioner who can do pretty good medicine for an affordable price on your chicken, right? She's
Correct.
not an avian specialist, but is she kind of a chicken specialist? I mean, I can't say that, but she probably knows quite a lot. And I had a friend from veterinary school about a year after we both graduated. He was doing like TPLOs in San Antonio. And I knew he was doing them. And so I would tell people in Austin, I'd say, you should go to the referral center. But if you can't go, I know someone who does TPLOs in San Antonio if you're willing to go see him. And that became like his thing. And I knew he was a person that I could send people to. And I think today we're not doing that, and we should be. And you said that. I got that you gave me a light bulb moment. I was like, why
What
aren't we doing that more?
what the fragmentation of the profession? Well, yeah,
Yeah.
I mean that's the biggest problem is just like you have all these veterinary clinics that all have the same difficulties, right? Staff, doctors, not enough patients, and they don't talk to each other. And could you
Yeah.
imagine if a couple of those practices just moved together? Obviously the cultures might be a little different, but you work on that. But all of a sudden, you have twice the staff, you have twice the doctors, you bring in both your set of clients in together. It works great. I mean, I was guilty of that, and the problem was I was just so freaking competitive in my in Laguna Beach. I mean, I didn't trust any of the other veterinarians. And it was just because which was unfortunate. I mean, because they were all wonderful, but I mean, they would make some medical decisions. You'd be like, huh, what? It would just be a little difficult that way. But I was guilty of that as well. But now stepping away, hindsight's 2020 always, and I can always tell that like that. Yeah, I really should have worked more with them. I should have done stuff like that with them. But I was also there were things too that really annoyed me because I still am the medical director of the Laguna Beach animal shelter down there. And but the thing is, like, they would do low cost spay neuter in the month of April and May. And people
Hmm.
who really couldn't afford spay neuters, or they just wanted a cheap spay neuter, they could buy this little certificate, which was free. And I would get paid like $100 per animal to spay or neuter them. And that included lab work, IV catheter, fluids,
Nice.
pain meds
That's
to
a
go
great deal.
home. Yeah, exactly. Because I always told the shelter, if I'm going to be your medical director, we're gonna do high quality medicine, because I think if
Yeah.
anything, shelter animals need more help than owned animals because you're trying to place them somewhere. And
Yeah.
none of the other veterinary clinics really got involved. I think I did 35 of them one year,
Wow.
and everywhere else was sitting at about 4 or 5. But that's how it goes. I mean, not everyone believes in that. And the other thing I
Yeah.
also wanted to bring out: if you do want to specialize, what would you do? I know exactly what I would do. What if you would say, "Hey, I'm going to specialize in something"? What would it be?
Me?
Yeah.
This is funny. I think as vets, like within our friends, like over dinner, we have this conversation. I'm always like, I don't know. Cause it used to be, I'll tell you right now, and I might get some heat for this from people who went this route, but it would have been radiology, ultrasounds and x-rays. The way my brain works is I can I don't know, pattern recognition in my brain is like very strong. And so x-rays and ultrasounds, like I've always been really good at looking at the picture and being like, okay, that right there, that's not normal. That reminds me of this thing. And then I can always go compare it in the book. So I've always been very confident in that. But the reason I don't think that would be my answer anymore is that I do think AI is taking its, time, kind of like edging in there. A lot of people are going to AI to read x-rays now. And it's really amazing. I don't 100% trust it just yet. I think I would rather still have like a safety net, like have AI scan it, whatever, and then still want somebody to look at it or whatever. And just for fun sometimes, and people probably get mad at me for this too, because I know there's environmental impacts, but I'll take a picture of an x-ray and I'll look at it and I'll be like, okay, this definitely is this. And I'll put it in ChatGPT. Most of the time it agrees with me. There's one time where it was like, oh, it's got a broken leg. I was like, no, there's definitely not a broken leg here. So you're not ready. ChatGPT, you are not ready for this. But I think someday we might get there. And then you won't really need the radiologist as much anymore.
OpenAI wasn't created to look at x-rays. There's specific platforms that do x-ray AI.
I know.
You got to train it.
I'm just having fun. I'm experimenting. Well, that's what I do.
Well, the thing is, what you got to do is before you put anything in a ChatGPT, always write these words in first. Set temperature to 0, period. It turns up, it cranks up the engines, it makes it work harder, and it makes it more accurate. Just
I've
so you
never
know.
heard that before.
Well, yeah.
What is are you like jerking me? Are you
no, I'm not. I'm not. No, you're not. It's not going to show some naked man jumping out of a bush or something like that.
I was like, what's going to happen if I put that in ChatGPT? Like, I'm scared.
No, I mean, the thing is that, obviously I'm an academician and a researcher now, and I use chat all the time. I mean, I talk to my chat in my car. As soon as I get it, I'm 52 years old. Marijuana is legal in California, so I tend to forget things sometimes. But if I talk in the chat, it keeps it going, and it also keeps a log of all your conversations, so it really helps. And it actually drives my all my companions at my content studio now crazy, because and I'm teaching them the benefits of it. Like, it could really help you. But getting back to, if I was to specialize, I would do dermatology. And I know I'll probably get heat for this, but I love it because I joke around about it all the time. You never cure anything and you don't have emergencies.
Yeah.
Right.
The emergencies.
What derm emergency is there? A hot spot?
Yeah, the people who show up at the ER for like an ear infection.
But they don't go to the dermatologist for an ear infection.
No, I know. Yeah, when they're going to the dermatologist, they know what they're going for, and it's usually not like urgent. So
yeah, and it's a revolving door, man. Nothing ever gets. You don't cure allergies. You don't.
That's so true.
You don't
cure anything.
So
well, and that's important. I always tell clients that whenever I always sympathize. I'll tell you right now, Dr. G, I think having a dog like an atopic dermatitis or a dog with severe allergies has to be one of the most unfortunate cards that you could draw, because you're not going to cure them. And it's a lot of work and it's a lot of money keeping their allergies well managed, right? You've got to do your medicated baths. You've got to do your ear cleanings. You've probably got to keep them on Apoquel or Cytopoint, even if you do immunotherapy with the dermatologist, if you can afford that, right? Forever. And then they're still going to get breakthrough infections. So they're still going to need, they're just money pits. And then not only are they money pits, but it just takes a lot of time. Like, I'm a mom of 2 little boys. And if my dog had an ear infection or a skin infection, I had to give them a medicated bath and clean and flush their ears every single day for 10 days. I would have a hard time realistically doing that. So I always level, but that's the first thing I say. I say, I am sorry. This is not easy. I appreciate and acknowledge your efforts and what you're trying to do. And I'm going to tell you right now, my job is also to manage your expectations. I'm not going to fix this. We're going to treat your dog today. It might be really, really bad because we haven't been managing his things for a while. Our goal is to get him to a manageable level so that we can maintain it. But he's not going to be cured, and you're not going to be able to just like not come back. I'm going to need you to come back. Because I feel like that's what happens. A lot of people go, oh, I went into the vet. I spent $700 and he got a little bit better, but then it all came right back. right? Because they're not told that it's never going to get better.
Well,
Unfortunately, I don't think we're setting clients up for success in that way sometimes.
right.
And I tell them, I say, what can you realistically do at home? Can you bathe your dog? If I were to send you home with this, can you do it? Because that's also really important to ask, right? Because like, what if they can't? Then that's how veterinarians get that bad reputation.
Oh, well, I sent you that post from today that I found that was all AI
Yeah.
generated,
Oh,
and
it was disgusting.
it was
Disgusting. That's
disgusting.
the
It's
first thing I
disgusting.
said.
So stay tuned. Stay tuned. I do have a comeback, but I'm professional about it. I'm not
Good. I'm
the
looking
typical
forward.
Dr. G that has so many opinions and so few filters. I was pretty good about that. And so
I think we need some less like lower filters at times though. We need a little bit of that.
so when you call yourself the honest vet,
Yeah.
what does that really mean to you? How did you come up with that name?
Yeah, that's a great question. So I was out of practice, maybe, I don't know, about 6 months. And I was just shocked by the amount of times that I would be in an exam room with an owner and I would make a recommendation or I would ask them something or say something and they go, oh, well, that's not what I'd read. Or I was told you shouldn't do that. Or I was told I need to do XYZ. And I'd say, where are you getting that information from? That's entirely incorrect. And they'd say, oh, well, I saw it on social media or like I read it online. And I'm like, from who? Like, who is putting this information out there? Because that's so wrong. And I got tired of seeing so many preventable illnesses and so many successful accounts on social media, like churning out garbage and just they clearly had no idea what they were talking about, but people were eating it up. And so I know that I was not gonna like, those people who are diehard believers of, whether it's anti-vaccination, whether it's that raw meat-based diet, I'm like, I'm not gonna change their mind. Like they're too far down the rabbit hole. I don't think I can go back in and get them out. But I wanted to provide an alternative narrative for naive pet parents who might otherwise fall prey to misinformation, right? They might be seeing that, they might not be sure how they feel about it, and then maybe they'll see me and they'll be like, oh, okay, like here's the other version, the other take, the other side. And so I wanted to start my social media account. But as we've discussed earlier, my first name's a little bit hard. It's a little bit of a mouthful. People don't necessarily know how to say it. And I didn't feel it'd be easy to remember, right? Because think about when you've got an interesting name as well, right? And when you say your name to people, they can't really like remember it because they're not entirely sure what you said, right? So then they're going to forget like what your name is. And then maybe they'll be like, so sorry, actually, can you tell me what your name is? Because I didn't understand you. So it's not a very memorable thing to have a unique first name, unfortunately. After a while, of course it is. You're like, oh, who is the person with that cool name? But like if you're trying to look somebody up on social media, it's going to be difficult if you don't know or can't spell their name. And then my last name was Simpson before I got married. I just got tired of hearing like the
That
Simpson.
I know. Well, that went in my head first.
Yeah,
I'm gonna be complete. I'm gonna be the
yeah,
honest Dr. G. That was the first thing that went to Simpsons,
like
but also
yeah.
the Civil and Simpson. I mean, you can't even say that three times
Someone
fast.
No, it was a beautiful name. I mean, I love my first name. I really do. Don't get me wrong.
But
It's
you but
unique.
you
It's
but you moved higher in
special.
the so if you go get another degree, you're gonna get your diploma a little quicker now because you're no
Yeah,
longer S, your age.
yeah. But anyway, so I didn't want to use my name for it, and I wanted to be like, well, I'm a veterinarian, but I just want to be like the doggy vet, or like I didn't like. I'm the kind of veterinarian who wanted to do all the things, see all the things, and so I knew if I was trying to get people to like not fall prey to misinformation and there's this narrative that veterinarians are dishonest and they're in it for your money, be like, well, I'm being honest. Like this is the honest reality of veterinary medicine. Like this is the honest vet. So that's kind of where that came from. And it was one of those things where I decided on it, like, you know, in a group chat with a couple of friends and stuck with it. And I'll be honest, I've had times where I've thought about changing it. Like, does this still really fit me? Is this who I am? I've talked to some other colleagues about it and they're like, no, don't change it. Like it's your brand
No,
now.
it is your brand.
Don't
It
change
is.
it. It's your brand. Yeah.
You can call
So,
yourself. You can change it. Start another page called the Realistic Vet. And
oh
just
my
be like,
gosh, I would have to be like I'd have to be like you. I wouldn't be able to show my face,
right.
and then I could just say all these things without worrying about getting canceled. But
Well, the thing
they're
is
just
that you don't worry about getting canceled because that the problem is again your honesty creates conversation, which is
yeah,
so important and so
yeah,
avoided because people are so afraid to have a conversation in all parts of life now that
Yeah.
really need to be had because they're afraid of the backlash they're going to get because of it.
100%. Yeah, that fear of the repercussion. And I think that goes back to the core of our conversation here, of that fear of the negative outcomes, right? And the fear of, well, what if I try and fail and then I get a board complaint because I didn't meet this standard of care, right? But again, it goes back to the proper documentation and setting yourself up to be protected in those cases, right? And then you still get to like fulfill your dream of doing all these things and helping as many animals as you can. Because ultimately, I think that's why we went to vet school. I know it's why I went to vet school. I wanted to help animals. I wanted to work with animals. I wanted to make their lives better.
Yeah,
So I
because
would think that,
well, the question you got to ask though is the fear the enemy of what we're dealing with, or is it kind of like a guardrail? And where do you draw that fine line?
yeah,
And I think that's why a lot of these early career professionals are having a hard time. So, I
yeah.
mean, I'm going to ask you, I know who I know what do you think where do you think this fear comes from? Do you think it comes from the education, the professional academians who are
Yeah,
incredible, but have never been on the front line? Do you think it comes
yeah.
from the employers, or do you think it comes from lack of mentorship?
So I definitely think it's multifactorial. I think
Hmm.
lack of mentorship is a big one, but
Yeah.
not the primary piece, because I ended up not having a mentor, unfortunately. I was supposed to. Very
But you
nice
did. You
veterinarians
had your
who were
mom.
working with me.
You
Well,
had
I
your
did. I
mom.
did. But when I went into practice, I was supposed to have like a doctor working with me in my GP clinic. And she was very nice Dr. Barker, funny enough, which is very funny. Was her last name, Jen Barker. Really nice woman. But she had to get back surgery and had some complications. You know, it was supposed to be a straightforward back surgery, but she had some complications and she ended up not coming back. So I was a new grad doctor as the only like primary clinician in a practice. And of course, we had relief doctors who would come through. But I had to draw upon my resources, because I guess my mom was the good example of like, you can do it. Was I still terrified doing all these things by myself? And even general workups, we talk about lack of mentorship, but it was like even doing like a workup for Addison's or Cushing's. I was like, oh my gosh, what if I do the wrong test, or if I don't interpret it properly, or maybe I should do this before I do that, because these are complex disorders that should go to an internal medicine specialist. And if we look at it that way, though, like, why do we have GPs who are feeling comfortable working up Addison's or working up Cushing's, which to me is honestly like, I would rather just give me the splenectomy, because like that's going to take so much less brain power than these other workups, like these long internal medicine workups. And I think it comes down to like a comfort level. Like for some reason, we're more comfortable doing these things. And so lack of mentorship, maybe like not enough exposure in veterinary school, because in veterinary school, we're not doing the surgeries, but we are like learning to study and research. So I think that's why maybe we're more comfortable doing these like internal med workups that again should go to a specialty clinic, but maybe they can't afford it. So we're managing that horrible like diabetes dog or whatever that just cannot get regulated, or that, Addisonian case, or some kind of complex tumor or cancer situation where they can't refer, but we're doing what we can with like, Stelfonta or Palladia or whatever. I feel like all of that stuff is just as complicated as some of these surgeries, but vets are scared of the surgeries. So I find that interesting, and I'm sure you probably do as well. And I part of another factor I think might play into this is, I wonder if this goes deeper, like maybe to the admissions process of veterinary school. And I'm not saying that I don't want to hurt any feelings or make anybody feel bad, right? I think there's a lot of really, really awesome veterinarians out there and their selection process is good, but I think maybe they're focusing really, really hard on these academic standards. And there might be just a type of person that's more willing to like go out and get dirty and do the things and say the things and maybe ask for forgiveness later.
Did you read my dissertation proposal? Because I think you're like spitting it out word for word.
I work with some awesome veterinary technicians that
Right.
would
Would
make
be amazing.
exceptional doctors. I'm not going to say her name. She doesn't like to be in my socials. She's off grid, but she's the one of the greatest techs I've ever had. She asks me questions sometimes about medicine that I go, that's a really good question. Let me go look it up because I forgot. Because and she doesn't even have the education that I have. She's just like that insightful and like thinks about the cases that hard. And she's applied to veterinary school 3 times and she can't get in because of her GPA. Her science GPA specifically is like a little low because she got like C's in OChem or something. And I'm like, okay, but a C in like that's not going to make, and I get it, right? You have to meet a certain academic rigor to be able to pass the NAVLE and to be
But do
able
you
to.
but do you really? Like, you use OChem every single how many
I
times have you
agree.
used OChem
Not
since
once,
okay,
not a
exactly.
single time, right? And but I mean, I get why they have this like need for a high GPA because again, they want you to be able to think quickly and study hard and all those things before you get into vet school because they don't want to see you fail. They don't want students that are going to fail. But I think we need to maybe go look at that and look at like the backgrounds of some of these students and maybe put a little bit more weight into some of their extracurriculars and their experience in veterinary medicine as well. I've worked with veterinarians who hate their job because they're like, I didn't know veterinary medicine was going to be like this. But I went to school for so long. I don't know what to do now. And I don't want to do like industry stuff. So I'm stuck. And I'm like, well,
Yeah.
that's really unfortunate.
Yeah.
Like that's,
Well,
I don't
I
know what to
mean,
tell you.
well, the thing is that okay, my independent variables for my dissertation are a realistic job preview, which you
Yeah.
had with your mom. And then
Yeah.
the next thing I have is professional identity. Like, do your values really equal what veterinary medicine really is? I'm looking
Okay.
at mentoring.
Yeah.
I'm
Mentoring
looking
is
at
definitely on
I'm
there.
look I'm looking at emotional intelligence,
Mm.
which, you know, let me tell you, if you don't have emotional intelligence, you're not going to make it in this profession. You're going to
Yeah.
have the worst time there is.
Yeah.
And, so with that, all that being said, that's the things I'm looking at right now. And it's unbelievable for me, at least with my dissertation. Again, you know as well as I do on socials and all that how much everyone's complaining, yet I can get 0 people to fill out this survey, which is insane. And I'm only looking at veterinarians that have been out of veterinary school from 0 to 5 years
Mm-hmm.
because that's where you got to get them, right?
Mm-hmm.
Um it's unbelievable to me. And I have a veterinary intelligence article that is coming out discussing how we're very good at bitching but not very good at doing stuff.
Yeah.
And I also released another one that was going after. I know you're Fear Free certified, but after the developer of Fear Free, when he wrote that horrible article about a month ago, did you read
Mark
that by chance?
Becker. I didn't read it. But I heard Dr. Molly Brinkman. She does Dr.
Yeah.
Molly Said. It's so funny. She did a parody of it in her
Okay.
stories. Yeah, she's hilarious. And so it sounded bad. It sounded like it came across in bad taste and it was removed. And I always like to assume positive intent. So I didn't read it. I'm going to hope that maybe he just came across badly. And, because the same way that people took my post and thought it was
Yeah.
bad. Maybe that's what happened to him. I don't know. He must be a nice guy. If he came up with Fear Free, I assume he's a nice guy.
Well, I mean,
I don't know
it's
him
not a
personally.
nonprofit, first off, but secondly,
Yeah.
the one thing that really gets to me is that, a lot of people say, we've done it this way for 20 years. That doesn't mean we perfected it at all. We're not
Oh, no.
evolving. We're not, as a profession.
Yeah.
We're not evolving.
Yeah.
Like,
Yeah.
and that is a huge, huge problem. And, the theory I'm using for my dissertation is the attraction, selection, attrition theory, which basically
Okay.
means if you keep attracting and selecting the same type of people, you get this
Okay.
homogeneous population of the
Yeah.
same type of people. Well, if
Yeah.
we keep selecting the same type of people and we wonder why burnout's not getting better, we're wondering why emotional intelligence or emotional labor is not getting better. We're wondering why burnout, I already said burnout, but just mental health is not getting better.
Yeah.
what are we doing to switch the type of people we're bringing in? So you're
Yeah.
absolutely correct. I think we need to relook at some of those things. And
Mhm.
and I'm not saying the veterinarians that are out there now, they're all
Yeah.
like that, but the ones I've noticed that at least that I've sat down and talked to that had issues are the ones that didn't have any previous experience before they went to vet school. I even talked to some
Yeah.
veterinarians that did not even have an interview to get into vet school. They got in.
Oh, wow. Yeah.
And as far as your technician goes, I would have her apply to Ross because the veterinarians I used to
Yeah.
hire and work with out of Ross are absolutely incredible because they
My
are the only veterinarians on the island. So
yeah,
day
my
one,
associate went to Ross, and she's pregnant, and she just pulled like a 10-pound spleen out of a dog who came in for limping, suspected cruciate tear, throw him on the x-ray table to check his knee. It's like, oh, also, what's in your abdomen? Like, so he still needs to get his cruciate ligament repaired. That's happening later, obviously.
right.
So she threw the ultrasound probe on him. She worked him up. The next day he was on the table. She's pulling his 10-pound tumor out of his abdomen, 6 months, and she's not 6 months pregnant, but like 4.5 months pregnant or something. And she's awesome. And she went to Ross, and she practices like I practice, right? Where she levels with the clients, she says, like, here's the pluses and minuses of me doing this thing versus you going to the referral center. Here's the cost breakdown. Here's what you should do. Here's what we can do. And I love that. I think she's doing great. And I feel like there's this, again, we talked about this divide in the veterinary world, right? There's this judgment, there's the specialists versus the generalists. There's the people who do it all versus the ones who really want to get specific. And then there's the large animal vets and the small animal vets. And then there's also the vets who went to school in America versus like the ones who went to the island schools. For some reason, I feel like they're like frowned upon or like considered less than. And in my experience matches yours. All the doctors that I've worked for from Ross, they all seem a bit like more willing to do things. And again, I don't know how to say this without coming across as bad. I'm not saying, but part of me is like, maybe that goes to what you're saying, where the type of student that tried to get into vet school in the States, didn't get accepted, but is still going to be a really good doctor, then goes to Ross, gets into Ross, and then comes and does incredible work here, making veterinary care accessible and affordable.
Well, they've left Ross
Yeah.
already doing a couple C-sections on goats and a couple GDVs and already
There you go.
fracture
Yeah.
repairs, and they've
Yeah.
done all that. And
Yeah.
that is huge. I mean, when my wife and I were senior year at Illinois, I came in already working at a veterinarian for 5 years before I got there. But, my wife's dad, he owned a veterinary hospital here in Southern California. So we came in and we were still in awe of how much they knew because they did when they do their it's like their fourth year here or four and a
Yeah.
half year here. It's
Yeah.
amazing what they know because they've done it. It's
You've
all
seen
that
it,
the see one, do one, teach one idea. And
Yes.
they were doing the
100%.
teaching by that time
Yeah.
to
That's
all of us
amazing.
seniors. Yeah.
Yeah.
So don't put down. I mean, that is something that might be on our radar. Maybe Clemson. I don't know what Clemson's going to be doing, but um,
Yeah.
I'm really, I don't think opening all these veterinary schools is the answer, but I'm really excited that Clemson's getting one. I think Clemson's a very reputable university,
Yeah.
and I'm excited to see what's going to come out of there. Maybe you
Yeah.
could get a teaching job there. You'll have to leave the
I've
coast.
got, I mean, I could do like some guest appearances because we go back to this too is we haven't touched on this yet as another issue or another factor, but a client expectations or
I was just
setting
about to go there.
expectations.
I was
Yeah,
just about to
I
go
think
there.
that's a huge problem. But I think there's a big fear of clients, but part of it I think goes to an inability. Not what am I trying to say? We are not always very good at communicating as veterinarians, as a profession. Communication is something that we struggle with.
Correct.
And so I think that makes us easy targets.
Correct.
And a lot of veterinarians are women who are people pleasers. And so they might not want to say the hard thing in in the exam room, like, hey, if I do this, your dog could die. And you need to say the D word. You need to say your pet might die. that instead of they might not make it, or it might not go very well, or there could be complications, you know, you need to say that and you need to document that, because that's how you truly cover your bases. And then also get your owners to understand how serious this is, so that if something goes wrong, they're not shocked. Because I think that is part of it. And of course, there are going to be some owners who are unreasonable. You might have done everything perfectly, you might have said everything perfectly, you might have set everything up perfectly, and they didn't get the outcome that they wanted or expected for whatever reason. And so they're unhappy, right? There's always going to be mean people. But I do think as a profession, we're having a bit of a communication issue. And that comes to like vets on social media. Like, I'm like, you know, there's people who are poo-pooing on vets having a social media. And I'm like, no, every veterinarian should be on social media right now. And we need to, every time we see one of these silly, ridiculous posts from these, you know, pet health coaches or whatever that are just spewing nonsense, we need to kind of police those, because that's the only way to do it. And then we need to make sure that we're putting out credible information. And if you don't want to be one of those vets, you don't have to show your face. I don't know if you've seen Tactical Veterinarian on social media. I have no idea who that man is. He could be a woman. It could be a woman. I've assumed it was a male, but it might be a woman. I don't know. I don't know that. Well,
you have an 87% chance that it's female.
Actually, no. Yeah, he's done a few where his face is blurred, but you can still see the body. So it is a man. I was gonna say, I'm pretty sure it's a man, but I have no idea who he is as a doctor. I've been following him. We've been talking for 5 years. He's awesome. He's another kind of do it all. He was a military vet, and he posts great cases. He posts really good information, but I have no idea who he is, and I've never seen his face. And you could do it that way if you want to maintain your identity, or maybe you don't want to deal with the mental burden of it. That's fine, because it is a lot and it can be exhausting. But then support your colleagues who are putting themselves out there, right? Support the colleagues that are getting, you know, torn down by the general public for saying that you should have your dog on flea and tick preventatives, right? Like, be there for your colleagues. And so we need to, like, as a whole, just encourage each other to communicate well and really focus, I think, on improving our communication, because I think that will help with some of these bad client experiences. Because if I were a client and I always think of it with my sons, right? Because I don't know what it's like to take my pet to the vet. I've never, ever taken, well, that's a lie. When I was on maternity leave, I took my dog to the clinic for my associate to give his vaccine. So I was like, oh, it's my first time taking my pet to the vet. But realistically, I've never, as a person of the general public, taken my pet to the vet, because my mom always did our veterinary care growing up. And then now I'm a vet and I know all the things. But I take my sons to the pediatrician, right? And so if I were to go to the pediatrician and they were to take my son and go, okay, I'm going to take your son to the back now and do all his vaccines and cut his hair and give him a shot in the butt, or, whatever, and then I'll bring him back to you, I'd be like, what? Like, where are you going? Like, so it has to be presented in a way, maybe we're like, maybe I like to do everything in the exam room when I can for that reason, because I think of it that way. But there are also some pets who do better away from their owners. So maybe, you've got to present it that way.
If the dog's name is Cujo, there's a good chance that the dog in back will be better, because and it's like, by taking the dog in back, you take away the security blanket from them.
Yes,
and but you also have to frozen.
Yeah, you have to communicate that. You have to say, hey, your dog's body language, it seems to me like he's hiding behind you. He's very defensive of you. And personally, I'm a little worried that he might react in a fearful way and harm himself or harm one of my staff. So I would like to try to take your pet to the back, if that's okay with you, for that reason. And we'll see how he does. Because I'm not going to be able to do a good exam on your dog if he's trying to crawl under your seat the entire time. I'm going to do a much better job, and you're going to get more value for your money if I'm able to put him on a lift table in the back. Because sometimes I feel like big dogs, you put them on the lift table and they're just like, whoa, I'm up high. Like, what is happening? They just like you said, they kind of freeze. And that's also not ideal. Obviously, I would love for them to be like happy and wagging their tail, but like, that's better than them doing something silly and then getting a bad rap and then having to get muzzled every time, because then that becomes a snowball, right? And so it just comes to how do we communicate that need with the client to bring the pet to the back, as opposed to like, we're going to take your dog to the back now. It just comes across different. And so, I mean, I think we need to go to veterinary schools. You mentioned, you laugh about me going to Clemson. I would love to go to Clemson and talk to students about how to talk to clients and manage their expectations, like the allergy example that I gave you.
Oh, Dr. Hammond, we have plans. We have plans for this.
Yeah, because
we do.
I think that's where we're getting a bad reputation. Again, that the client's going to go home and say, I spent $700 and nothing got better.
Oh,
Right? Because
they'll broadcast it to the world.
exactly. And then you're the bad guy. You're the bad guy. Or you step out of your comfort zone. You do this surgery for a lower cost because they couldn't refer, but you didn't explain to them. You didn't look them in the eyes and say, your pet might die. I'm not a surgeon. This wound could dehiss and we may have to euthanize. I want you to understand that's the options. You can go to the specialist or I can do it, but you know that this could happen. There's a low chance. It's very small. It's a very small chance, but it could happen. But I'll try anyway if you want me to try. And I'll tell you, I've never had a single client ever that I would feel would want to like take me to the board. Like even that client that the wound dehisced, the dog that I did the 7-day corn cob foreign body surgery on, they were just so thankful that I tried. And they thanked me and they kept thanking me. And I was like, oh, don't thank me. I couldn't save her. I tried my best, but I couldn't save her. Don't thank me. But they were like, no, thank you for trying. You gave her a chance. And her last few days, they said she seemed so much more comfortable that at least she got those last like few really good days with us. So they were just thankful that I tried.
So do you think do you think your time on social media prepared you for handling those hard clients? Because I would think some of the feedback you get on social media could be very hateful.
That's a good question. I've never thought about that. It is, sometimes I do get a lot of very negative things said about me personally, which I find interesting. I think sometimes when people don't agree with what
you want to give us?
No, just, I think people will personally attack someone when they don't have any basis to their argument, right? They're mad about what you're saying. They don't agree with you, but they don't have any evidence to back up their arguments. So then they look for like a person, like you must be a bad person instead. Does that make sense? Like they try to tear you down because
you
they
don't have any
tear
compassion.
down your argument. Yeah. Yep. And I mean, I kind of forgot where I was going, like this train of thought. Sorry, it just left. You said, yeah. No, I think in a way it does, but I think at the same time, I've just always been a strong communicator. So maybe it's hard to know. It's like, what came first, the chicken or the egg, right? Did I make my social media because I was a strong communicator, or has my social media made me a better communicator? I'm not sure. And I hadn't really thought about it. So I think that's why I'm struggling to answer that question. But I do think it's definitely made my skin a little thicker.
Yep.
Hearing and seeing some of these things on social media, it's made me just a bit more realistic about some of the population that we're dealing with, and some of the clients that we're dealing with. Like there are some clients that, again, you're not going to be able to make happy. You're not going to be able to do things right. They don't know. Yeah. Ignorance is bliss, right? Everything's going well for them.
Right.
Their argument is solid because they don't know what they don't know. Have you heard of the Dunning-Kruger effect?
Yes.
It's my favorite effect. It's so true, right? So the more you learn about something, the more you realize you don't know about it. And the more you realize how many gaps are in your knowledge of it, right? So the less secure you actually feel explaining it because you realize how much you don't know. But the least you know about something, the less you know about something, the more comfortable you are talking about it because you have a surface level understanding of this complex topic and you don't understand how much you don't even know. It's an amazing phenomenon. It really is. And we see it every day on social media.
I know, but is that part of that phenomenon laziness as well? Because like if I don't know something, I stay up to 2-3 in the morning just trying to learn as much as I can about it. But
yeah,
I mean, that's the one thing I don't know about the Dunning-Kruger. Is it that they just don't want to go out and figure it out? Are they lazy? They think they know enough?
I don't know if I would even call it laziness because I think it depends on your motivation, right? For me, I want to know everything I can possibly know about vaccines, for instance. Right. I, as a mother of 2 young boys, I had to decide, was I going to have my children vaccinated? I'm a veterinarian. I do vaccines all the time, but you still hear all this anti-vax stuff. And I thought, could there be any weight in this? Right? Because I'm about to do this to my boys and I just want to make sure I'm making this. So I sat down and I did my own research, as much as I hate to say that, but But I also have a background in medicine. So me doing my own research is a bit different than your average Joe, because at least I can kind of really understand what I'm reading, and I can also critically evaluate data, right? Not all data is good data. I was trained, we had a class in part of our pharmacology class, actually, was how to identify good data and critically evaluate data. That was priceless. That was probably one of the best parts of my veterinary school education. And our pharmacology clinician, she even had us argue for the other side of things sometimes, just to like practice. Like, it was so good, like look at all the evidence, like go against your biases, like identify your own biases. We learned all of that. It was great. I loved that class because I use that all the time now. And I had to make this decision about whether or not to vaccinate my own boys. Ultimately, I did vaccinate them. Obviously, I mean, I'm very medically, pro-vaccine and medically forward and everything. But yeah, I mean, these people on social media, they're not so invested in learning about this, right? They don't really even understand kind of how vaccines and the immune system work. So they wouldn't really even be able to go down this rabbit hole, because they'd have to start back in immunology. To really understand it, you'd have to go back to immunology 101, right? And nobody wants to sit through. I hated immunology, right? I don't want to go back and sit through my immunology lectures until 2 a.m. My motivation for that is very low. My motivation for learning about vaccines is very high. And for some of them, they might jump straight to that. So they miss that crucial foundation knowledge to understand immunology. So I don't think it's necessarily laziness. I think it's more of a motivational issue, like what motivates each person uniquely. And I think just the general public needs to kind of remember, like, their humility, right? Like, you need to remember that you don't have this foundation of knowledge. Like, I couldn't go build a bridge. I'm not an engineer. I have no idea how to do that. Do I want to stay up until 2 a.m. learning to build a bridge? Absolutely not.
You would have to stay
Absolutely.
up to many mornings till 2 in the morning to learn how to build a bridge.
And you would also have to stay up until many, many mornings to learn about vaccines, right? But for some reason, the general public feels that they can just understand this incredibly complex topic after watching a few videos on social media, or staying up until 2 a.m. one time, watching very biased and selected videos on YouTube. So it's a dangerous time, really, to be practicing medicine. And again, I don't think it's laziness at all. I think it's a motivation problem, and a motivation problem for multiple factors, like whether or not it's a personal interest or a relevance, or whether or not they just think they need to know. But I like to know everything I can possibly know about medicine or things that apply to my life. So, when I started seeing some of these exotic pets with Dr. Berger, I thought, okay, if I'm going to do this, I'm going to do it to the best that I possibly can. And so I would stay up until 2 a.m. doing exotic CE. I went on Vin. Vin has some excellent exotic CEs for beginner. They've got your Rabbit 101. It's like 3 hours of like bunny stuff. And then they've got their Anesthesia 101 it's like another 3 hours for bunnies. And there you go. I did that. I did the ferrets one. I did all this stuff because I'm like, well, if I'm going to see these things, I want to make sure I'm not, I'm going to do the best that I can for these patients. And again, so much of it, though, I only needed those short blocks of lectures because I had already built this huge foundation of knowledge in veterinary school and clinical practice on which I could apply it, right? Because you couldn't go to YouTube or whatever. You couldn't go to Vin as a layman, as a person outside of medicine. You couldn't go to Vin and watch one of those 3-hour rabbit videos and then be ready to do rabbit medicine, right? You have to have all of that other education first.
Well, why go watch a 3-hour video when you get a 30-second clip on TikTok that tells you everything?
I know. From somebody with zero scientific background.
Exactly.
And it's hard. I recently learned, Dr. G, that the average reading level in America is 3rd grade.
Well, if you do content, you know that all content needs to be done at the 5th grade level.
Is it the 5th grade? Okay, I did not know that. Well, I didn't know that, so I'll have to update all my stuff. Like, maybe that's why I've some of my stuff, I'm like, why didn't that do better? It's because I use some words like, but that's disheartening to me, somebody who's trying to combat misinformation, because it's so much easier to believe and understand the person who's simplifying topics so much so that they're like discrediting us because our topics and our explanations are too complex for them to understand. So we're the ones who are wrong, right? Because we're like, no, that's not how this works. Blah, 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 all these medical terms that they can't understand, right?
Well, it's an art to learn how to explain medicine to a client in a way they understand.
Yeah, it is.
And what I always tell, the people I would be mentoring, I'd always say, okay, imagine that's your mom sitting there. How would you explain
Yeah,
what's going on to your mom or to your
that's a great
brother
way to say it.
or your uncle or,
Yeah,
that's how you have to do, or your best
your
friend.
your third grader, your 8-year
Exactly.
old.
Exactly. Just
Yeah,
so and I don't want to say dumb it down because you don't really dumb down medicine, but you got to put it in
yeah,
words that they understand. So
100%,
I want to put you on the hot
100%.
seat. You ready for these?
Okay, yeah.
Pet obesity, is it neglect, true or false?
Oh, that's a rude question for me. Um, it depends. If you know your pet is obese and you do nothing about it, I would say that's neglectful. If you're ignorant to the fact that your pet is overweight, then that's not neglectful. Can I do both? Can I have both?
Oh my gosh. Okay, you're not going to pull aside. Okay, that's fine. Veterinary medicine is moving in the wrong direction, true or false?
Oh, these are not nice questions.
Well,
I
you said
think
you're honest. I just taking you there.
I worry about the future of veterinary medicine if we continue to move into a realm where it is so specialized that pets will ultimately lose access to care and affordable vet care.
Yeah, I'm worried about the cost of care. 1000%. That is a huge
Yeah.
concern I have.
Yes.
But we need another big recession, and I hate to say recession because that R word kills a lot of people as far as their businesses go. But they're going all these big corporate groups that are charging astronomical prices are going to learn very
Yeah.
quickly that if you make veterinary medicine a luxury item, that is the first thing to go.
Yeah.
Right?
It's
People
true.
are still going to go get gas in their car. They're still going to go buy clothes, yet there won't be brand name clothes. They'll probably, go to Walmart, a
Mhm.
homage to your Walmart, to buy their clothes. They'll get groceries, but they will wait till that dog's pain threshold is an 8 out of 10 before they bring him in
Yeah.
instead of a 3 out
Yeah.
of 10. So
Yeah,
that
they'll skip the parasite prevention for those bugs they can't see,
yes,
right? Because they can't see it.
exactly.
They're not
I
getting
can't I
yeah.
can't see that. Oh, and
Yeah.
just remember the one thing a lot of people don't explain to their pet owners is that one flea bites a dog 100 times to get a full blood meal. Think about that.
Yeah.
Imagine getting
Yeah.
100 mosquito bites. How would you feel? Um,
Yeah.
are vet schools really producing this imposter syndrome instead of producing confident doctors?
I would actually say yes to this question. I'm going to confidently say yes because when I graduated veterinary school, I actually felt a little bit less than because I didn't specialize. And I think a part of that is that there's a lot of pressure in veterinary school to specialize because everyone who's teaching you, everyone around you did specialize. They chose to specialize. So the fact that you're not specializing is almost frowned upon. Maybe it's in an unconscious way, but I did. I remember telling people, I was like, well, I don't want to specialize. And they're like, oh, and we had one student I was on a rotation with in small animal surgery where we went around at the beginning of the rotation. We all, kind of introduced ourselves to our clinicians and our residents. And we said, our name, where we were from and what we wanted to do. And she proudly said, she goes, I want to do GP. And everyone was like, oh, you just want to do GP? Like dog and cat GP? And she was like, yes, I want to do GP. And it was weird because the people who want to do large animal didn't get that reaction. It was like large animal GP is okay, but small animal GP was not. It was kind of like, oh, that's all you want to do,
Can I
So when
one
I
up you on that?
graduated,
Can I one up you?
go
How
ahead.
about how about the fact that, oh no, I don't want to do an internship. I'm going to go right into private practice.
Yeah. It was like, well, why not? Why don't you? And I was like, well, I don't want to work as a full-time doctor for like 60 hours a week plus weekends and get paid 30 grand or something like that. I was like, I got student loans, I got bills to pay. Yeah. And I was definitely judged for that decision. I was personal friends said stuff to me like, oh, you don't want to go be, they said that you don't want to go be a Banfield vet. I was like, no, I don't want to be a Banfield vet. Like, I just want to go practice. Like, like in that, we need those vets. We need those vets who are doing the wellness care. And that's what I was trying to clarify earlier too. Like, it's okay if you want to do wellness because we need wellness care is important, right? Keeping the pet population in general healthy will keep more pets healthy by that herd immunity. But yeah, so imposter syndrome I do think is real, right? It's like, oh, the specialist should do this and the specialist should do that. And they're not really setting the students up to be a great generalist because of that.
Okay, for years we've had the same talking points, right? More mentorship, more support, but there isn't any change. What is it going to
Mhm.
actually take to disrupt that cycle?
No, I wish I knew, and I wish I could. I'd love to put something into action to do it, because I do think we need to do mentorship and empower these students to do more as generalists. So part of, well, I guess if I had to come up with something, and something I've actually been thinking about, is we need maybe to get some more generalists teaching in veterinary schools, so that veterinary schools can see, okay, this is what a confident and capable general practitioner can do. And then maybe even at the CE level, right? When we go to CE conferences, it's mostly specialists speaking, almost exclusively. It's rare that you see just a GP giving a lecture on how to do something, even though a lot of GPs are incredibly adaptable and versatile because they've had to be. And they have so many awesome tips and tricks they could teach us on, like, again, how to do a splenectomy at 10 a.m. and then do a TPLO at 11, and then, do a Cushing's workup at noon. It doesn't have to be that, specialized, but
Right.
just how to see so much in a day and how to manage that,
Yeah. And
right?
well, I'm very excited to say I am running my first CE, Ready Vet Go, as asked if I would run a CE.
There
And
you
it's going to
go.
be very simple. It's going to be called diarrhea, and it's going to
I
be
love
run
it.
by me, and we're going to
Runny
break it
diarrhea.
exactly. And we're going to break it down very simply: puppies, kittens, adult dogs and cats, and then seniors. I have
Yeah.
2 lectures I'm gonna do. They're 20 minutes long, but I'm gonna break it down and basically keep it simple. And like, you don't, like, I understand there's amazing tests that you can run, but not every case needs all those amazing tests. And what
Yeah.
if you run the run and you're running the wrong test? Then you got to break
Yeah.
that to the client. Like, oh, we
Yeah.
shouldn't, yeah, and I bring this back because I bring this story up all the time. When I was a senior in veterinary school, a dog came in for a nuclear scan of the liver because they thought I had a shunt.
Mhm.
And then they did an ultrasound, and then they did an endoscope. And then I remember asking, has anyone run a fecal on this dog? I don't see it anywhere. The freaking dog had
Whipworms or
whipworm.
something. Yeah.
After,
There's
I, I mean, come on. I mean,
Yeah.
those are simple things. And even the specialists get it wrong. So don't think the
Yes.
specialists and
Yeah.
the academians are the end all be all, because they make
Yeah.
mistakes too. So,
100%. 100%. Yeah.
okay.
But I no, I
So,
do think that would be the solution, is putting more capable generalists in front of veterinary students and even young career veterinarians, so that they can see, like, hey, these guys did it. They're doing it and they're successful.
right. Two more. I got two more of these hot seats, and then I got a couple
Okay.
questions to finish it up, and we'll be good.
Okay.
Um, if you had the power to redesign a veterinary school, what was the first thing you would let go, and what's the first thing you would bring in? I know I'd bring in
Hmm.
would be GPs. You already answered that,
Yeah, I kind of already answered
and
that.
you
So I'd
can't
probably
and you
bring in
can't
more
say
general practitioners.
immunology. You can't say immunology or virology. Okay, you can't
Can
get
I
rid of
let go?
those.
Can I let go of parasitology? Because, like, that's a lecture that I do feel like is kind of we've got all this. We don't need to identify ticks anymore to see what diseases are coming, because we can just run a tick PCR panel and then give the dog NextGard and then. But
Right.
what would I let go? That's such a tough question. What would I let go? I guess I think vet schools. It's hard, because when you're a fourth year vet student, you think, oh my gosh, here I go. I'm going to get to do the things, see the things, touch the things, feel the things, but you don't,
You're
right?
fourth.
There's the
You're fourth
clinician.
on the depth chart. Yeah, you're
Yep. There's
fourth on the
a
depth
few
chart.
residents, there's some interns, and then there's you. And you're lucky if you actually get to, like, watch a surgery. And I felt very lucky. I actually got to scrub in on a hemilaminectomy. Try saying that after you've been talking for 90 minutes. And hemilaminectomy. And I was standing right there, and it was awesome. And I was like, oh, guess how many times we got to do that, though? Like, once. I got that once. And it was because it was like a 2 a.m. surgery. It was like, we did it like in the middle of the night on this back dog, right? And I did it with the third year surgery resident. He was awesome. He was so nice. And but that was his choice to let us. Not all residents have to do that or are willing to do that, right? They don't want you standing there. They're worried you're going to mess them up. He was like, 1 month away from finishing his 3rd year. He was going off to private practice. He was basically boarded neurologist at this point. He was like, and he was so nice. And I think he felt bad for us. And he was like, here, you want to see something cool? Come stand here. Watch me do this. And I was scrubbed up. I was gowned up. I wasn't allowed to touch anything, but I was right there. Right.
Don't breathe on it. You can't breathe.
Yeah.
Yeah.
And what's crazy is like of my full year, we do 52 weeks, we do a full year. That was like one of the only times I really got to be like up close doing things. Of course, like, you get to feel your cranial drawer sign, and you get to do some bandages on ortho, and you get to, place a couple of catheters in ER, and maybe if you're lucky, you'll get to do CPR if ER is really busy or something, and do some stabilization. But in terms of like hands-on stuff we got to do in vet school, it was quite low, unless you were on an externship and away from the hospital. And then only if you were doing like one where they had that kind of medicine being practiced. So I do think they should make some efforts to get students more hands-on stuff. But I guess that's more of what more stuff I would bring on, right? So it's like, what would I get rid of? It's hard to say, right?
Right.
We had to.
Yeah, I don't know. No, I'm thinking about what
I don't know what I'd get rid of. I can think of a lot of things I would want to bring in and add in.
But you have
it's
to
like,
get
what would
rid
I
of
get rid of?
something. Yeah.
Yeah. I don't know. Well, you know what I would say is for like all the kids who really want to do large animal, and like really, 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 really want to do large animal, it's like, are you going to make them do small? But then I think about me, right? I was thinking I want to do large animal, and I ended up doing small. So I kind of understand why you need that too.
Yes.
So it's tough. I don't know. I can't. I don't know if I can answer that.
I kind of get rid of tracking. I definitely would.
Oh yeah.
I would train people to be veterinarians again, but
yeah,
that's just me, because you know how much, equine internal medicine taught me. I actually was supposed to do an equine internal medicine internship and then do a residency.
Okay.
But then I decided, hey, let me do 14 weeks of clinics in the equine ward during foaling season. That changed my whole concept of equine medicine like that.
Yeah.
I'm fascinated by equine internal medicine. I thought the professors I had in that were amazing because they brought real life experiences in when they taught, which was awesome. And it also taught you how, equine medicine's a lot about insurance and a lot about, what the horse really truly means.
Yeah.
But, I was also very lucky though, because having those 5 years at a veterinary clinic before I went to veterinary school, those two doctors I worked for, those two guys were my second and third dad. And, they took me under their wing and they taught me everything. So I was very lucky. So I knew if you go into veterinary school with the hours, like your technician, I hope she gets into vet school, but she'll go in there and she'll be able to read through the lines like, okay, that's a bunch of crap. I really don't ever need to know that. Oh, that's important. I really need to know that,
Yeah.
because you can really place it. Like I would make immunology and virology one course. Sorry.
Yeah, you absolutely could.
Yeah, you absolutely could. And I would get rid of poultry medicine because I didn't need to learn about ducks. And I actually spent a month learning about ducks. And I'm like, I love ducks. I think ducks are cool. I would love to own don't get me wrong. I would have my own pet duck. I want a pet turkey. I want all those things, but I don't know if I need to do that much in the poultry, but that was just me. But I wouldn't change a single thing about veterinary school as long as, because I was the C equals DVM type of person. I made sure I went. See, if I was at Illinois, so I went to the football games, I went to the basketball games, I went to everything that Illinois had to offer, because I'm like, this is so cool. Like Texas A&M, I tell you, I know where I'd be every other Saturday during the fall. There is no doubt.
Oh, I was there. No, it's hard to say no to that.
Okay, exactly.
Name.
Yes, that you got the 12th fan. It's amazing.
Yeah. You hear the call, the Aggie whoop, and we all come running like locusts.
Yes, exactly.
It was fun.
So now, last two questions I have for you are just, I don't know if they're personal, but I just want to know, because you're doing a phenomenal job with your online presence and your platform.
Thank you.
You're doing an excellent job as well, being a veterinarian, and you're also a mom and a wife at the same time. How are you balancing all that?
I mean, I don't, right? There are times where it's not a perfect balance, right? Sometimes it's this way, sometimes it's this way. Um, I often feel like maybe I'm letting one part of it go at a time to like do more over here. So I always tell people that I'm not balancing it. It's social media is a highlight reel. You know, you guys see, you know, if I look easy, I look confident up there. You don't see the imposter syndrome. You don't see the girl who used to throw up before surgery days, right? You just see, you know, I've had students who come through and they're like shocked when I tell them that. They're like, "Oh my gosh, you know." I was like, "Yes, me," because like I might look good and confident and capable now, but the only way to get better at it is to keep doing it, right? And it's the same kind of with life. It's like I'm not really balancing it all. I'm just doing it because I recognize that I can. Like I survived vet school, right? So like working and having kids, it's it's just another thing you have to do. It's another part of life. It's another phase of life. Right now, I think I might be the busiest I'll ever be with the young kids and the job and the side hustle on social media. But one day I know that my kids will be older and I'll be just devastated that I'm not picking up Legos at 10 p.m. after the boys have gone to bed or
You
getting
mean
up at
stepping
5
on
a.m.
Legos? You mean
Yeah,
stepping on Legos when you're half
yeah,
asleep?
right. Well, that's why I have to pick them up before I go to bed because I've done that, right? We don't want to do that again. So I mean, but it's a beautiful ride. And you know, if everyone's different, some people really value creating, you know, a really good balance in life. And some people need that. And I don't know that I'm that kind of person. I think that I get bored very easily. And I really, really like challenge. And I find that for me, I don't like to be too comfortable for too long. I'm like a shark. Like if I stop swimming, I'll die. So I need to kind of keep going. And then of course I'm like, you know, I get tired and I need to take a break. I need to take a step back and then I come back again. And I've taken several breaks from social media when it just gets to be too much. I've disappeared for like 3 months at a time. And I've always felt so good about it. I'm like, oh, I'm so glad I stepped back from that for a little while because the scales were tipping too far. So I needed to kind of jump off to let these come back up. And then now that I've gotten these back up to stable, I'll come back here again. So it's not always this perfect balance that it might seem. It's a lot of struggle and a lot of give and take. But I do find everything that I'm doing to be so rewarding. I wouldn't give up any of it. I wouldn't give up my career. I love my job and I love what I do. I would never give up my family. Becoming a mom is one of the greatest things I've ever done. And again, it's not for everybody, and that's okay. But for me, it was a must. And it's been so fantastic. And it's also, I think, made me a better doctor, right? Because I can say, you know, if this were my child's pediatrician, how would I want them to talk to me? And it all comes together. And then on social media, it's social media is my therapy sometimes for this job, right? I can go on social media and I can rant and rave about the animal I lost to the flea infestation, right? Because that's my therapy. That's my outlet for some of the frustrations that I have for seeing animals die from preventable illnesses in 2025. That's how I process that. And I need that to keep me sane. And it's fun at times, right? So there's times where I can be very dramatic and I can share the hard stuff. And there's times where I'm just having a laugh. And I feel like that in itself is part of a balance.
Well, if you can't laugh at yourself, then you really are
Yeah.
gonna have a hard struggle in life in general,
Yeah.
because life is
Yeah.
a
You've got to be
grind.
able to laugh.
Life's the grind.
You
I
can't
mean,
take yourself too seriously.
yeah, and like I said, being a mom, that's unbelievably difficult. Even if you have that progressive marriage and the husband does 50%, it's always still the moms that make those doctor's appointments, schedule. Even though the dad will be driving carpool, mom schedules the carpool.
So
You're
true. That is
you
so
need to,
that is so
and then you're picking up the Legos at 10, even though he probably
yeah.
picked them up at 9, and you're making sure they're all picked up. It's
He's
just
probably like cleaning the kitchen while I'm cleaning the living room. My husband's fantastic and he's a wonderful
right,
father and I'm
right,
very,
exactly.
very blessed. And that's probably part of why I can do all this is I also have a lot of support.
Yeah,
Um,
absolutely.
yeah.
Well, I would love to have your mom on here one time and interview her next.
She'd be
Let's
fun.
let's find out about
She'd
the
probably
true
be more
Dr.
fun than I
Hammond.
am. Well, she's also, you know, 65 now, so her filter is completely deteriorated. She just does not care anymore. She'll tell you like it is. She can't get canceled. No one can cancel her. She's done. So she'd be a wild ride.
Oh,
She could
I
tell
would
you
love.
about the
I
things
would
she's
love to
done
have
and
her.
seen. Yeah.
Oh my gosh,
Yeah.
that'd be amazing.
Oh yeah.
Okay,
I can look
last
that up for
question.
you.
Oh yeah, you would? Oh, that would be awesome.
Yeah. Yeah. She'll get more views than I will though, and I'll be a little hurt.
Oh my gosh. So the competition starts.
Yeah,
That's
you'll also have to
amazing.
have your beep button ready because she has a pretty potty mouth. So you'll have to like bleep.
I do too. No, I do too. I'm being very, very good right
You
now.
are.
Like
You're being so good.
yeah, the F-bomb is a medical term, in case anyone was wondering. Uh, if this conversation sparks one crucial conversation tomorrow in the clinic, what do you hope it's about?
I think the same topic we've been kind of coming back to again is that I want generalists to believe in themselves and to know how capable they are to do more than just the basic care for dogs and cats. I want them to recognize that they went to veterinary school and they've built this incredible foundation of knowledge and that it translates across species, it translates into different aspects of the field, and that you are so capable as a doctor and you don't have to be afraid of messing up as long as you acknowledge to the client that you can. So I would just want to remind my colleagues, I want to spark the conversation of remembering what you can do and being willing to try when needed.
And make sure you mark it down in the chart.
Mark it down, document everything thoroughly.
Yes.
And unfortunately, like I said, I have not yet had an experience where it's been a problem. I've had threats, and this was just general practice. This was before, and it was nothing that went anywhere because they were really empty threats from just some unsatisfied patients back in Austin when I first started practicing. And that was hard. Just hearing from clients that they dislike you and the way that you practice, that's hard. It's hard getting negative feedback, but I'm thankful to never have been.
You were fresh out of school. Your mentor wasn't there.
Yeah.
What did you expect?
Yeah.
What did you expect?
Yeah. And I think part of it too is that maybe I didn't communicate with them properly, right? Like if I had been better about setting expectations and having and saying the hard things in the exam room that I'm able to say now, I might not have ended up in those situations.
Yeah. I agree 1000% with you on that. So, but let me tell you, Dr. Hammond, it's been an absolute pleasure. We could probably go on for another 3 hours because you and I, you might be a different sex than me and be a lot younger than me. But I mean, the thing is, you and I do have one thing in common though, which is we are cheerleaders for this profession. And we really want to give back. Yeah, this profession's amazing. It's done as much for your life as it has for mine. Right. And I just hope I want all veterinarians to feel the joy that we have. There are hard days. I'm not saying there aren't hard days and where you question yourself, but it should just be a day, not your entirety. So, well, it was great talking to you. I will be talking to you again soon, I'm sure.
I hope so.
Yeah, I'm not scared now. No. And by the way, I did homage to you. Do you see?
I did notice that. I
did that for you. And
thank you. I'm jealous though. Next time you have to ship one to me so we can have one together.
Oh, dude, you can go to the Piggly Wiggly and go pick one up.
We've got the Harris Teeter, the Publix.
Harris Teeter. Oh my gosh, I miss Harris Teeter so much. I forgot about Harris Teeter. That's like the Trader Joe of the Carolinas. It really is. It is. So we'll to everyone listening out there, we'll catch you next time here on our Irreplaceable Truths. Talk to you soon. Yay.